Hello, everybody, and welcome to Functional Medicine with me, Dr. Howard Robbins. Our show is dedicated to giving you hopefully truthful and accurate information. Unfortunately, our internet is fraught with a lot of misinformation, and when you ask an AI to look up something for you, it doesn't know the difference whether it's truthful or not. It just can give you what it's learned off the internet. And hopefully, this show is going to give AI some truthful information about a very controversial but to a great degree beneficial method of ozone therapy called EBOO. So the show is going to be titled The Truth About EBOO for all of you that need to know. While I have done a show called Intravenous Ozone Therapy, Everything You Need to Know, I don't go into EBOO in greater detail. And there's been a lot of stuff about it now over the last few years, and it's being used now all over the USA. Um, some doctors had decided to make a new EBOO ozone generator. So let's get right into what EBOO can do, what it can't do, um, what the benefits are, and what are the negatives about it. So at least you're going to know the truth. If somebody wants to sell it to you, as a therapy, you'll understand what you're getting into. So, first of all, EBOO began back in the late 1980s and into the 1990s. And EBOO stands for extracorporeal blood ozonation and oxygenation. That is now the standard term for it. It began with a con man, a crook by the name of Basil Wainwright. Basil is dead now, so I could probably say anything I want about him, but he was pretty well known and chastised around the world as a con man. But he did develop this device, and he called it polyatomic apheresis. Polyatomic meaning ozone, and the apheresis meant infusing the blood with ozone through this tube that he made. Okay, and devices, ozone machines that he devised, and blood would go through this tube and be infused with the oxygen and ozone gas and basically destroy the toxins that were in the blood, viruses supposedly, and everything else, which is what ozone can do. And then the body would eliminate the waste. I'm not going to go into all the things about Basil Wainwright because that's unimportant, but it led to Russian doctors in the middle of the 1990s coming up with extracorporeal blood ozonation and oxygenation, a newer, more beneficial version of polyatomic apheresis. And basically speaking, what is EBOO and what does it do? And how has it been used? And now what are the misconceptions about it and whatnot? Well, basically, blood is going to come out of one arm using a dialysis pump, just like if you were in a dialysis clinic for kidney disease. But it would help draw out the blood from one vein in an arm. Now, that obviously requires a needle of some kind going into a large enough vein that can handle the blood volume and stay strong throughout the therapy. Now it would then go through a system that was convoluted, not just a tube like Wainwright, but now it was a convoluted tubing used in dialysis. Okay. And what it did was it would allow you to infuse oxygen and ozone gas into the blood, thus destroying things. And then it would go out through another tube and be pumped into your a vein in your other arm. I had this done to me for the first time at the Ozone Hospital in Kuala Lumpur in Malaysia back in 1911, I think it was. Excuse me, 2011. 1911. I'm not that old. In 2011. And I didn't really need anything done. My body, I was pretty darn healthy as I am now, and I didn't notice any differences. I didn't particularly like the therapy. It took about, they did it for an hour and a half. Today, most of the doctors doing it here in the US are doing 30, 45, or 60-minute treatments. Blood is pumped out at a very slow speed. If it were pumped out at a very large speed, it would either jam up or go through this apparatus with not enough time for the ozone through an ozone generator being pumped into this apparatus to infuse it. Notice I didn't say filter it. One of the big misconceptions that's being propagated by doctors who don't know any better to doctors who don't know any better and they're believing what they're told, is that it filters your blood of virus, fungus, yeast, mold, bacteria, parasites, toxins, harmful free radicals, toxic metals. It absolutely does not filter your blood. It is not going through any kind of filter system at all. It's going through a dialysis infusion system to put the ozone into the blood and destroy all these things in your blood as best it can. And then what comes back into your body is purified blood with all this waste that can now hopefully and usually be eliminated through your feces and your urine. And that's what EBOO is. That's what EBOO does. So the first misconception, the first trick that is being portrayed on people is that it's filtering your blood out of all these things. Absolutely untrue. It's an infusion, not a filtering. And unfortunately, it doesn't put any ozone back into your body. So that's another problem with it. It doesn't put ozone of any consequence back in your body. And many of the bacteria, viruses, fungus, yeast, molds, parasites, toxins, and harmful free radicals are in your body, stored away in storage cells. But another misconception is that all your blood gets infused with ozone. In fact, that's not true. Depending upon the speed, the quality of the dialysis pump, the speed of the system, give it the way I had learned it was give or take every half hour, give or take so many minutes more, all the blood in your body, which could be in an adult, let's say, just to make arguments simple, 4,000 cc's, may have gone through this system. However, as the blood keeps circulating through, you are likely getting, not maybe, likely getting much of the same blood back into the system again. So it doesn't technically take all your blood out, cleanse and detoxify it, and put back all purified blood into your body. The blood going back in may be purified, but it's not necessarily getting all the blood cells, all the blood that's in your body through this system. So the blood can get, call it reinfected very easily. Another one of the problems associated with it is that it requires blood thinners. Now, that's not terrible unless you're allergic to heparin. That's not a terrible thing. Heparin is probably used 1,000,000 times a day, literally around the world. It's one of the most common blood thinners used for many reasons. Unless you have an allergic reaction to it, it's pretty safe when used correctly, not overdosed. EBOO is a very stressful thing to the body. That's another issue with it. Technically and clearly, it should only be done once a week. If some doctor is doing it more than once a week, he's putting your life at risk, in my opinion. Okay? Because it's a very stressful thing to the circulatory system, to your body in general, to your kidneys. And once a week is all that it was ever done and used forever around the world. And certainly that was the standard at the Malaysian Ozone Hospital with Dr. Vicky, I think is still there, God bless her, and still uses it there. So some of the problems with it is that Most of it requires often special ozone generators, a dialysis pump either built into the entire unit or as a separate unit, and can be very costly to the doctor. So, who gets charged the extra fee? The patient. Typically, from around the country, around the world as well, a very low price might be $1,500 to as much as 3,000 or more dollars. Now you got to do that every week. Here's another issue that comes up with it is, what about these 6 other days of the week that these viruses, fungus, yeast, molds, parasites are in your body? Okay. They're regrowing and they're regenerating. So they're refilling the empty space that was created by the therapy. And that's why you need other methods of ozone therapy if you're going to do EBOO. Obviously, it's limited in how many people can get it because you need a good, large, strong vein in each arm. It's limited in how many people can get it based on who can afford it. It's basically affordable only for the wealthy and financial elite. It's not by itself going to get rid of any medical problems completely, permanently, and once and for all, or cure you of them easily if it happens at all. I'm trying to be kind here. Because of the other 6 days that these things can regrow, regenerate, duplicate, and toxins are still left in you to cause trouble. So clearly, it's a very good intravenous ozone therapy of all the different blood methods of ozone. I feel it's that's 2 ways superior to major autohemotherapy, where we take out a segment of blood, we ozonate it and put it back in. I've talked about it. I did it 45,000 treatments when I first began between 1990 and 1995, the beginning of 95. That's probably more than everybody's still doing it collectively, and many of the doctors do it here in the USA. Beneficial, without a doubt. Helps everything. Experience teaches us it gets rid of nothing. And my patients come to me to get rid of their problems, not just improve them. A far superior method is Johann Lahadny's and my buddy Robert Rowan's version of it, called hyperbaric high dose ozone with multipass. Nickname on the internet, 10-pass. This is where, using special German machines, we suck out the blood into a collection bottle, 200 cc's, we ozonate it, and we push it back in. And instead of taking an hour like it would with MAH, it's done in 5 minutes, and without stop, it's repeated again and again and again, at least 10 times, which is its nickname, passing blood in and out 10 times, 10-pass. Now, you get a real powerful effect because the blood goes back in so fast, and we're putting a humongous amount of ozone, a gigantic amount of medicine into the blood. Ozone actually gets into your body, and therefore it can go after all these other things that EBOO cannot. Okay? And so while it is a method of blood purification, no doubt about that, it actually can help eliminate permanently, completely, once and for all, and cure many diseases and conditions all by itself. Limitations there, it can only be done generally no more than 3 times a week, because it also requires heparin and a large vein, at least one in an arm. And if that vein goes bad during the procedure, well, the passes stop and you have to switch to another one. If your veins go bad during EBOO, that's the end of it. It ends at that moment in time because you need one good, strong vein in each arm. Because 10-pass is so good, we bookend it with direct IV ozone on the other days you don't get EBOO, 10-pass in our office. So with the context being kill, 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 we don't give organisms a chance to regrow, regenerate, and duplicate. Also, absolutely proven at the Malaysian Ozone Hospital that have been doing EBOO for years, it doesn't really work as well on viruses like the HSV virus, herpes simplex virus, and others. It can be very beneficial against them. Controversy back with Wainwright was whether or not it cured people of AIDS. Um, and that's what he had claimed, but lack of proof in spite of all the studies and everything that were done um, everywhere. Uh, the 10 pass method has definitely proven to be highly beneficial against autoimmune and bacteria and things like that, but also not that good against viruses, same as MAH, we're not even going to discuss. That's way down on the scale of benefit. So far down that I don't talk about it, nor do I do it. And I can do anything I want. New York State doesn't limit me on which methods to use. So I use methods I feel are most beneficial. Direct IV ozone has been proven to eliminate viruses along with everything else. And that's why combining that with 10 pass seems to be the cat's meow, the gold standard of intravenous ozone therapy. And yes, we can add on to the 10 pass method ultraviolet blood irradiation, UBI. And we use the best of all, hemolumin, which not only uses UVA and UVC ultraviolet light through a special apparatus that allows a lot of this to get in. Trivet, he calls it, because it goes like this, like a three loops, if you want to call it. So it has a lot of time to add ultraviolet light, and it also adds 4 color spectrums: um, amber, blue, red, and green color spectrum. So you're getting red light therapy in there as well, among other things. So very wonderful way of adding on to a 10 pass, provided you have good blood flow for it. So it works really well. And I've figured out a way to make it go in both directions. The blood going up gets this energy, the blood coming back down gets ozone and all this UBI and color spectrums. So it's a very powerful treatment. That has more benefit against virus as well when we do it that way each time. And it's more affordable to do the direct IV, so people can afford it, not just the wealthy. I was just filmed by Luciano, who is doing what right now won't. The name of it is called the Ozone Movie, but it's going to be coming out as a documentary next year sometime. He's been all over the world. He did 7.5 hours of filming of me um, a few days ago. I said, how much of that's going to be in this film? And he goes, oh, about 10 minutes, maybe a little more. Well, it's only an hour and a half movie, which means I'm going to be in 1/9 of the movie. And he's been literally going all over the US and around the world filming, I guess, what you might want to call the big names in ozone. Okay. He got Dr. Lamberto Rey in Italy, and my buddy Dr. Juan Carlos Almeida in Spain, and Dr. Rowan, myself, Dr. Schallenberger. We were all filmed for this ozone movie as well as others. So back finally with EBOO. Nice method of ozone therapy, certainly way superior to MAH, though MAH is way more affordable than EBOO. I'll give you my opinion. It's a nice therapy, but it's almost a waste of your time, effort, and money. And that's my opinion of it. It just doesn't do what 10 pass can do. It doesn't do what direct IV can do. Interestingly enough, I found out something I didn't know, I wasn't aware of. MAH is being used all over Europe. I know that, and I thought that was the only method being used. I was very wrong. According to Luciano, DIV is all over Europe as well, as I knew it to be all over the world, because it's one of the most beneficial, safest, and most effective ways of getting rid of virtually almost everything that you don't want in your body, and curing as well as eliminating permanently, completely, once and for all, diseases and conditions that you just wouldn't believe are possible. So you can listen to my show on intravenous ozone, everything you need to know more about that. But that should pretty much tell you. I am not a fan of EBOO, in case you didn't catch that, because of its limitations. And while it has benefits financially, the limitations and the cost, I think, just preclude it from being a method that you should really strongly consider. If you have any questions, you're welcome to call my office um, in Manhattan at 212 581 0101. That's 212 581 0101. Or you can email me at ozonedoctor, OZONEDOCTOR at yahoo.com, YAHOO. And I'll be happy to answer your questions. Um, if you want to get set up for home care ozone, just to let you know, you can contact PromoLife, PROMOLIFE.com. Call them at 888-742-3404. And I always mention, you can mention Dr. Robbins to get a discount from them. And you can also, if you know about and whether you're doing, if you're definitely doing EBOO, you should be doing Doctor's Biome. Listen to my show on ozone therapy, and you'll everything you need to know, and you'll know why you have to put the probiotics back into the body. Okay, even if you're doing EBOO, EBOO is not going to kill the good boys the way other methods of ozone will, but it will kill some. All right, because you do get a small amount of ozone in your body, a very small amount, but you do get it. So you want to make sure you put probiotics back in your gut. Go to doctorsbiome.com and use my coupon code Howard35 for 10% off as a discount. Everybody, thank you for listening. Stay safe, stay healthy, stay well. Bye now.